Together we achieve victory over heart failure.
Namaste. I'm Dr. B.S. Vivek, a senior consultant cardiologist at Sir Gangaram Hospital, New Delhi. I'm also the director of clinical cardiology and non-invasive imaging at our hospital. So, what is heart failure? Now, the heart failure has to be seen in 5 different aspects. The word failure actually comes from the fact that the heart fails to do what it is designed to do. So the heart's work is to basically pump blood to all the parts of the body. If this pumping function becomes less than that is desired, this is what constitutes heart failure. Heart failure may be perceived by laymen as heart attack or sudden death, but that is not true. It's simply the inability of the heart to do its work. It fails to do what it should be doing. So heart failure basically is of 2 types. Either the pumping ejection fraction that is called is low, that heart has become weak and the muscles are not pumping as vigorously as they should. The other is the heart may be pumping normally, but it fails to relax properly. That means it becomes stiff. So both of them lead to the same symptoms of fluid overload. And then why are so many Indians affected by heart failure? That's a common question. Now that is something which is being worked upon, but basic mechanisms that can contribute many of them is the various lifestyle modifications that our body has had to adapt in the last couple of generations. Our genetic makeup is such that we were designed for famines. So now we are going into a high carbohydrate diet, sedentary lifestyle, stressful activities. The Indians are known to have a genetic makeup which was not designed for this sort of a lifestyle, which was more prevalent in the Western population. That, it is believed, is one of the major factors, the lifestyle problems that we are all facing. So moving on, what are the signs and symptoms of heart failure? The simple symptom of heart failure, as I said, is fluid overload. So there is congestion. If there is congestion, that is fluid accumulation in the lungs, it leads to breathlessness. And if that same fluid goes on to accumulate in the body in other parts, for instance, the lower limbs, there'll be swelling in the feet. So this is easily visualized by patients. And before that, they would be having fatigability, they would be having breathlessness. And these are the common symptoms of heart failure, which should be detected as early as possible. So how can we protect ourselves from the disease? So there obviously it is multidimensional way in which we should proceed. Obviously, lifestyle modification is paramount, and we should obviously give up those activities which we know are bad for the heart. That could be smoking, excessive alcohol, sedentary lifestyle. Now, all these play a very vital role. Thereafter, we have to maintain our pulse and blood pressure. There could be a regular monitoring of them. And then we should always meet a physician or the cardiologist who would then dictate us regarding the medications that are essential. So with the combination of a lifestyle, pulse BP charting, investigations which are to be done routinely, and medications, heart failure patients can easily lead a good life. So lastly, what comes next after a heart failure is diagnosed? So as I said, once the diagnosis has been made, there are certain tests which let us know what is the intensity of the disease and what could be the causative factor. So that is decided by the cardiologist. Echo and ECG are very common tests done in very little time, and they give us a vital clue as to the cause and the intensity of the disease itself. And then there could be, if you want to know the reason that has led to this muscle dysfunction of the heart, coronary angiography may be warranted. So these are tests which are going to be dictated by the cardiologist, and along with the preventive and treating measures that I just enumerated, the heart failure can be easily controlled. Thank you.